Good afternoon, good people. Today, I'm in the midst of two, let me say, overqualified people. And being in this presence of them makes me feel quite underqualified. On my right, you know him. He's the CEO of the Human Garage, a doctor of chiropractic, and the first fascia manipulation teacher in Africa. On my right is, I'll let him introduce himself because I don't know his specialty, what he specializes in, and like you, I am quite oblivious to those facts. So this session is going to prove to be one of the most informative sessions that we've had in a while, and I bet at the end of this all, we'll have gained a lot. So to start it all, let me not say that I've introduced our CEO properly. I'll let Dr. Hamisi start. Dr. Karibu.
Thank you so much.
Yes.
I like calling Zawadi. My name is Dr. Hamisi. I'm a chiropractor. I specialize in fascia manipulation by Stecco. I've been in the practice for the last 26 years now. And over the last 26 years, I've developed my own treatment program or model we call the 12 Weeks to Wellness. And the 12 Weeks to Wellness is nothing other than a program created with an understanding of the human anatomy and the human physiology, how they function, and then an understanding of what goes wrong when the two don't work as they are supposed to. So a dysfunction will develop, and a dysfunction will cause then a cascade of problems that so we treat as what, pain or disease. So I started the Human Garage with a name of looking at health and wellness from a different perspective, from a perspective of function. What is it that you cannot do because of whatever condition you're suffering from? Running away from the model which is science and symptom management, which is the model of modern medicine. And we need to understand that the modern medicine model is not bad. We need to understand that first of all, that the modern medicine model is made purposely to rescue you during emergency. You have had a crash, you need a surgeon. You have had a pneumonia attack, you need to be in the hospital. You have something acute, an infection, something acute, you need to be in the hospital. And the physicians who work in the hospitals have been trained in a very qualified way and very specialized way to be able to handle you during the emergency situation and help you stabilize. And it's after this stabilization that now you need to cross over to us to help you restore the functionality that you have lost during the emergency period. And this is where I come in.
Great, Doc. Yeah. So now we move on to our next guest, Dr. Adam. It will be of great importance for you to introduce yourself to our viewers, where you come from, what you do, where you work, and why the term doctor. I know they've heard the word doctor. You explain to us what doctor do you specialize in, what field of medicine you are in. Yeah.
Thank you for having me.
Yeah.
My name is Adam, Dr. Adam Kabamba Kadinga. I'm from Congo, if you want me to say. I'm from Congo, but I've been in Kenya for now 2 years. I'm a medical doctor, my profession, and I'm a general surgeon and laparoscopic surgeon. I work in a private hospital in Kitendela as a surgeon. So I open the abdomen, I restore some function, as Dr. Hamisi said, when the patient has an acute infection that needs surgery and something that needs to be repaired, I do that. Thank you very much.
Wow, Dr. Adam. Karibu sana to the Human Garage. So, first question is, where did you meet this guy? Where did you meet him?
That is very interesting
question.
Let me say it as a believer, a Christian.
Yes.
For me, I believe that there is two things in the human environment. There is your work that you have to do, and the God work. So your work is your assignment. You have to study, you have to follow your passion, and God do the rest to make people meet.
Yes.
And there is one say that when the student is ready, the master appears.
Yes.
So maybe I was ready
Yes.
for something else, for
Yes.
another transition,
Yes.
and then we met in a conference in the dinner of the Estonian embassy,
Yes.
and we start talking, and
Yes.
everything clicked up.
Wow. Doc, do you remember that night?
Absolutely.
Yes.
It was the Latitude 59
Yes.
event
Yes.
that Mochama, my friend,
Yes.
had invited me, and at the same time his friend had invited him. So we met in a forum to discuss wellness.
Yes.
And it's in this discussion that I had the opportunity to explain to the doctor what I do, and also show him part of my work in terms of like my curriculum, my school curriculum, and
Yes.
how what I have trained in.
Yes.
For him to have an understanding, how does working with my hand come in relation to what he does?
Yes.
And I'll be very honest that that was my favorite night in a very, very, very long time. Let me explain. Since I became a teacher of fascia manipulation, and since I became the first and the only black in the world doing this fascia manipulation by Stecco, and having seen the potential this method has, and also having seen Chinese doctors, Japanese doctors, Israeli doctors, European doctors, American doctors, South American doctors, medical doctors. I'm talking about medical doctors.
Yes.
We are not talking about physio, we're not talking about osteopath, we're talking about medical doctors, Italians. In different specialties, pain specialists, surgeons, I wondered, why can't we have this in Africa? Why can't I be having someone to hold my hand so that we can help spread this and introduce a new way of healing to our people?
Yes.
So when I talked to Dr. Adam and his eyes lit, I was like, wow, I hope he has not lit his eyes because I'm barefoot. He has lit his eyes because he's interested in what I'm talking about. And we continued engaging. And Dr. Adam, I'll tell you, is a very wise man. He never said yes or no. He never bought into my idea or not. He went and sent me a patient. Not one, not two, several. And this sending me patient over time in the last 2 months has solidified our relationship. Because he has seen that despite the fact that I can give him a good chat and convince him verbally,
Yes.
I can also deliver exactly what I'm telling him
Yes.
to his patient.
Yes.
So this created an interest for him as a surgeon.
Yes.
Why? Because I believe, and he's gonna tell us, as a surgeon, when you do a perfect surgery, you want to see a perfect recovery. So when you do a perfect surgery and the outcome of your surgery is not as perfect as you did, I don't think as a surgeon you are very proud.
Yes.
All right. So it is the fact that we can work together to help him, to help many patients within the simplest and the cheapest way possible, that this relationship has started.
Great.
Yes.
Yeah, so, Dr. Adam, I can see now how the human connection was formed between you two. So, I'd like to ask, what drew you to fascia manipulation?
Yeah, actually, what's made me to click.
Yes.
It's the philosophy I have about medicine.
Yes.
And I told him, and it was the same as the philosophy of fascia manipulation.
Yes.
We are not taking a patient
Yes.
as like when I have, for example, I have a headache, not just I see the head. There is a lot of things like behind that head.
Yes.
Maybe he had a stress job, maybe he has a problem. And when you have that vision, the holistic vision, it's easier to help a patient.
Yes.
And the way he treats, it's the same. There is a connection
Yes.
between the outside and the inside the abdomen. And when I heard what he was saying,
Yes.
and my philosophy of what I believe in medicine and what is that Dr. Hamisi is doing, I saw that there is something, and there is that connection that can make something big
Yes.
And when you believe in something,
Yes.
it's what it takes.
Okay, now tell me about the reaction you had when you saw the patients whom we sent to Dr. Hamisi and how they were treated and how they displayed their reactions to our treatment. How did you feel? Did you now know that this is the right course of it?
Yeah, actually, absolutely. When we were connected,
Yes.
and because I believe in what he's doing. It's not like a monkey see, monkey do.
Yes.
It's about everything, the connectivity of the body.
Yes.
I knew that exactly. He'll be like the patient will get everything. And even I don't know if you ask all my patients, I send them.
Yes.
I assure them. I tell them I have someone
Yes.
who will exactly help you.
Great.
And it's what it has been.
Yeah, great. So now let's go now to the main point of this interview. Doc,
Yes.
tell us what you did for him. Let me not say it. Tell us what you have.
For me, is to help him, is to encourage him.
Yes.
First of all, as a surgeon, to encourage him to do a manual model, a biomechanical model, a treatment that to study. Actually, not just to send me patient,
Yes.
but him himself to go to school
Yes.
and study. And you know what? I gave him a challenge, and he took the challenge. And next year, he's going to be the second African. In the second African in the international school. This is amazing in many ways. One, Africa requires this method of training. We have medical doctors, we have osteopaths, we have physiotherapists, we have chiropractors, we have people in very different fields of medicine that will benefit from an understanding of the body connectivity, the fascia tissue, the 3D biomechanical model of the human body in the management of their patient. So many of the conditions that we said we don't know what caused them, the idiopathic conditions, their solutions can be found, for example, in the superficial fascia. For example, numbness. A lot of patients are complaining of numbness. A lot of patients are complaining of cold legs, cold feet. A lot of patients are complaining of loss of balance. A lot of patients are complaining of ringing in the ears, etc. Name them. Or recurrence of infection, arthritis, inability to walk. And him as a surgeon, when he goes and studies fascia manipulation, he will be better placed as a surgeon, first of all, to be able to perform surgeries that don't go against the muscle fibers. Why is that important? That is important because of the healing of the patient. For the faster healing of the patient, the doctor will be able to do surgeries that are seamless, that are emerging within the way the fascia is, and respecting the fascia connectivity gives patients an advantage in the outcome of their surgery. Number one. Number two, he will reduce the amount of surgeries that he will be needing to do in his office. Number three, it will be cheaper for the patient long term. Why? Because when we treat the body without opening it, without putting a lot of drugs in it, we give the body an absolutely potential for it to heal itself naturally with less side effects. We are not saying we don't need drugs. No, drugs have a room to play. Surgery has a room to play. All these things have a room to play. But we all need to understand, based on the damage each one has, we start with the least to complex.
Great. So, Dr. Adam, you're going to Fascia School next year. How do you plan to integrate this non-invasive mode of treatment with your invasive mode of surgery to help your patients be better?
That is very, very interesting question.
Yes.
Actually, let's just go with an example.
Yes.
For example, when a patient has something called peritonitis, for example, it's when there is an infection in the abdomen cavity, and the patient needs surgery, for example. He needs surgery, not for example.
Yes.
And then we have to open the abdomen, and we go midline incision,
Yes.
and we remove the infection,
Yes.
and we close.
Yes.
But when you go, you didn't go like with a laser or something. You have to go through the muscle, through the skin, through the fascia, through the muscle, and go in. And when you close, you finish the infection, it's gone, okay?
Yes.
But you had some damage you did to the abdominal cavity.
That's true.
And those damage, you went through some small like vessel and some small nerves,
Yes.
and the patient need to recover 100%, as he said.
Yes.
That place need manipulation.
Yes.
Yeah, and there are those other patients. They have many patients with chronic problems, something like that. As a patient I just saw now, the patient doesn't need a lot of medicine and doesn't even need a surgery. For example, for me, I know when I have a patient with lymph nodes, my first reflection is just go in, remove the lymph node, and put it to the lab for inspection. That is my. But I don't have that. I didn't have that notion that I have to go deeper and see what can be the cause of that. For me, it's like there is something. Let me go and it's a damage. And
Yes.
most of the time, if it was just an inflammation,
Yes.
can you imagine the damage I caused to that? So when I go to the school of fascial manipulation, it will give me another perspective. What I say, it's not like 1 + 1 = 2.
Yes.
It's not an additional things.
Yes.
It's a synergy.
True.
Like it
That's
gives a big result than what can be done 1 + 1.
Yes.
It's a lot. And those examples, the importance that he said, the advantages, all of those Dr. Hamisi said.
Great. So, Doc,
Yes.
what can Dr. Adam expect in his practice when he goes to fascia school?
Wow, first of all, he's gonna go and start studying things like you're building a house.
Yes.
He's gonna go and get an introduction. You know, like you're building a house, you have to start by doing msingi.
Yes.
You know, so you start learning how to do the msingi, how to place the initial blocks of the house,
Yes.
until the house is completely done.
Yes.
Where now you can from treating a single joint
Yes.
to treating multiple joints to treating muscular and internal stuff, or internal stuff and muscular, or muscular or internal and internal. You understand?
Yes.
Depending on how the body will complicate, to treating systems. Okay, so as a doctor, he'll be. I'm just so excited because he is also someone who can easily go into research and help open this can even more. You know, open this can even more into research, so that even other doctors can see the importance of this and how they too, if they can study and incorporate this in their treatments, then we can end up having amazing outcomes for our patients, which is the dream of every single physician. You want to see the result of your work. When you don't see the result of your work,
Yes.
as much as you are happy, you are frustrated. Yes. You know, it is always, I don't know, but me for myself, I will tell you, if I take money from a patient and I don't see results, I don't feel very good. But if I see results from the patient, it beats anything else. Why? Because then we have both won. The patient has won and I have won. I've gotten a living and the patient has changed their life.
True. So, look, for those unfamiliar, I know we've used some complex words.
Yes.
For those unfamiliar who are watching, how does fascia manipulation differ from other therapies like physiotherapy? How does it differ from?
Fascia manipulation is a method. It's not a technique. Now, when you have a method, it's a way of doing things. It's like a mathematic formula. It has precision, from a precision understanding of specific spots that needs to be manipulated to change tension. So you need to also understand precision. How can you interview your patient to be able to go into the specific reason or specific clue why the problem started? So with this understanding, and with you understanding how the anatomy of the body is and how the body functions, then you are able to put one and one together to know, oh, okay, I can use this method to release tension here, and restore an even balance in the whole entire system. You understand?
Yes.
Because the body is controlled by tension and the nervous system.
Yes.
So you have both. We have central nervous system and we have an autonomic nervous system. It is in understanding how we can stimulate these systems to restore functionality of the body, so that the body innate intelligence can help the body heal itself. We say the power that made the body
Heals the body. Oh, great. So, Dr. Adam, when you came in today, you got a session you got a chance to see Dr. Hamisi when he's in session. So, what was your initial? How did you feel about it? What was it part of your expectation, and the way the patient reacted? How did you feel about this method?
Okay, to be honest, I was convinced, and I'm convinced about what Dr. Hamisi is doing, but I didn't know what is going on. Me, I knew that maybe it's an advanced method of physiotherapy.
Yes.
And when I went inside there and I started asking patient question, the complaint, and I would say, why? If there is a problem, just treat it. But he went deeper. 10 years back, 15 years back, like 1998 back, and he found something. The patient came with the head problem. The patient came with the problem of the knee joint problem, but out of everything, it was just a problem on the finger, the foot, the toe.
Yes.
And for me, I was, what is going on here? And when he started doing things, and you see the results are immediate, I was wow. But up to that time,
Yes.
I didn't understand anything until he showed me
Yes.
the scientific part
Yes.
of what he was doing.
Okay.
It was wow.
Okay.
It was a miracle.
So, Doc, please explain to us that bit, the importance of a history session in treating a patient.
In fascia manipulation, we say old is gold.
Yes.
And here, when I started this place, I called it old school medicine. Because we cannot, in my opinion, progress to the next evolution, to the next big thing in the world, and ignore the history, the wisdom of our forefathers. Because it is in the wisdom and the shoulders of the giants that we stand on today. It is not our own discovery. And now it's from the wisdoms and the shoulders of these giants that we are trying to now lift what they know and try to push it slightly further. But we are not creating anything new.
Yes.
So when we have to treat a patient, we need to understand that actually most of us are born sick from birth. I was in school the other day. We were studying how to treat children from 0 day to 1 year. Now, with the way we treat here, if I told you I treat a baby like that, you'd be like, oh, we're gonna kill it. But no, we need to understand, if a baby is coming out of the mother's womb, for example, a natural delivery, and for example, they get their head not very well, and their head is pushed in an extension like this. Alright? And this baby is born like that and has been like that for so long. The fascia that goes back to the back will go into spasm. And if this baby is born, the baby might have problems of, for example, with feeding. Maybe the baby is crying too much, maybe the baby is having colic. And this thing we can treat with antibiotics, and the baby will stabilize. But this baby has already started a problem that would have been corrected between 0 and 1 year. Why 0 and 1 year? The fascia at this time has not formed reinforcement. Your fascia and my fascia has already formed reinforcement. Yes. Collagen fiber is already established. But this junior one, you can change.
Yes.
So understanding a history of a patient from us back as when they were young to now gives you a bigger picture for you to know what has happened to this person from that time to now. For you to understand what has happened, what happened then, how did it compensate to what we have now.
Yes.
That's why we are not treating the sign and symptom here. We are looking for the dysfunction, where it started, so that we can correct the pain.
Great. So, Dr. Adam, now, when you finish fascia school, how do you plan to advocate fascia manipulation to your peers and also professional colleagues?
Yeah, actually, the chance we have when we are in the specialty, like in medicine, fascia manipulation or like modern medicine, it's because it's the results that are same. When you do what you have to do as a surgeon, and you help a patient to be very good, it will be the outcome that will say by itself. When I have a patient, for example, I did thyroidectomy, for example, and he came or she came after surgery, and we did some session with her to establish everything on the neck and everything. And there is another one who had that but has a problem. You see, it will be a debate, and at the end of the day, patient will come, and it's how we'll be advocating the fascia manipulation, part of like a synergy, part of the modern medicine.
Great. So, Doc, what can Dr. Adam expect before he starts?
Oh, he just has to read. There's a lot of reading. But being a surgeon, he's not afraid of reading. So fascia manipulation is, again, it's gonna be maybe very easy for him, because as a surgeon, it's all about anatomy, and this will really, I think, will be very great for him. And the good thing is also research. You know, we say a knowledgeable hand is powerful, but that knowledgeable hand can only be powerful if it's supported by anatomy and physiology of precision.
Great. As we close up, Dr. Adam, so tell us your final words, final thoughts, how you feel now that you're enrolling into FM school.
For me, it's just a word of gratitude to Dr. Hamisi, who is my friend, and the way he trusted me, he trusted my word, and he wanted me to feel what he's feeling. For me, it's a gratitude. And the other things, that's like the additional part of medicine that I was believing, and that I can be able to practice. Is just wonderful. You know, there are patients. One day we were discussing with Dr. Hamisi, and I told him, sometimes patients, they come to our office, it's not because they are sick, because they want someone to hear them and someone to touch them. When you touch them, it's a big part of treatment. And if we can be able to make the hearing, the touching, and the doing in one part, it's just amazing.
Great. So when you finish school, will you join us at the Human Garage?
So even before I finish.
Great. Welcome to the barefoot culture.
Actually, that's what I was lucky, because I saw even in YouTube something like that, and then we met, and I had already some small notion, but the way he's doing that, it's another level. It's like
great. So, Doc, how do you feel now that your dream is growing? How do you feel now?
It's amazing. First of all, I'm very happy that a medical doctor has given it a chance, because it is going to separate. It is going to help to separate. Waswahili wanasema mbivu na mbichi. Ripen, the ones that are ripe and the ones that are not ripe. Because those people are going to hear also from another person, and also a person of authority. All right. So
Yes.
that it is not always said. You know, people think, oh, you're a chiropractor. Chiropractors are quacks. That is how people dismiss people very fast. All right. But now we are putting forces. Like in Europe, we have in my class we have physiotherapists, we have medical doctors, we have osteopaths. We all work as a team.
Yes.
And this working as a team, we learn from each other. And this has built a big symbiotic relationship. And we refer patients across each other. We have a network of patient communication or referral. And this is helping more and more patients. And more specifically, for the physiotherapists, for the osteopaths, for the medical doctors, the young ones, who are getting also frustrated, they don't know what other line they can take. This is another line. Because can you imagine how many people are crying? My arthritis, my acidity, my gas and bloating across the globe. You know?
Yes.
So this is the opportunity.
Great. So, if you don't know, Dr. Hamisi has just come back into the country. And Doc, I'd like to ask you, have you finished studying fascia manipulation?
Not yet.
How many years so far?
Oh my goodness, I've been in school forever. I think I'm very thick. It takes long to get into my head.
Yes.
But it's 26 years now since I finished school, but I've never stopped learning. Since I graduated, it's 26 years today. But I've never graduated.
So what?
Every year I'm in school.
So what does that say about fascia manipulation?
It's an evolution.
Great. That's the word. Okay, so final note, Dr. Adam, tell something to our viewers about your experience of with Dr. Hamisi, the human garage, and fascia manipulation.
What I want to say to everyone who is watching, fascia manipulation, it's we can say now it's just something that is amazing, but it's an old medicine, and the old is best. And for me, I'm very convinced. If I can send my patient here to human garage, it's because I know the outcome. And even today, I have seen the outcome of one of the patients who had the problem for a long time. So coming here when you have a problem, chronic pain, it's not cost you a lot, but it will help you a lot, because pain is not a lifestyle.
Great. And Doc, tell us just a final note to our viewers. This is something.
Yeah, just tell people the same. That the innate intelligence, the power that made the body, heals the body naturally. And God, when He created human being, He created this map that only few will understand how to use it to help His people heal. We are among the few who have started seeing this. And in so doing, it is not our knowledge, it is not our power, but it's Mother Nature who is the best doctor. And I add barefooting. It's the barefoot doctor's prescription. We say every organ in the body needs to keep it between stretch and relaxation, because pain is not a lifestyle.
Great. So there you have it, our viewers. And before we close, Doc, what if someone is watching here and wants to enroll? Do we have classes here?
Oh yes, this year, look at our page. We're going to be doing fascia manipulation level 1. We're going to be also doing moxie version. We are also going to be doing shiatsu classes, all international accredited courses. Watch our social media pages, the advertisements, and look for the dates and the details required for coming soon.
Great. There you have it, guys. So keep it locked here at our social media pages if you're interested in this mode of treatment. As you've heard from the two doctors, what matters to them most is you. Your well-being, your health is what drives them. It's what makes them wake up each morning. Your welfare is what drives them. So every time that you think you're going through something or not, please remember there are people who care for you. And in fact, the Human Garage, the first clinic in Kenya, offers this mode of treatment. So come here, get all your wellness needs in check, and for sure, you'll meet Dr. Hamisi here, you'll meet me here, we'll talk a bit, and in the future, Dr. Adam will be here. So until next time, be safe. Goodbye.
Thank you.
Thank you very much, Stecco.